So next we have Leslie doing quality assurance.
My name is Leslie Tinker. I've worked with WHI for 16 years in nutrition, primarily helping to develop and monitor the dietary intervention, the low-fat dietary intervention for Women's Health Initiative. And because of also having involvement with quality assurance. See, he's Mr. Magic. You're in good hands with the database. So what we're going to do is talk a little bit about quality assurance and quality control. And what you'll see from this presentation is that there's a lot that's still in the works. So this is a shell. This is an overview. It is an outline of what is going to be in your QC manuals for that section. And these are the elements in the manual that you will have in Chapter 13 when you receive the manual. So we've got the first part, good clinical practice. And the reason that that's underlined is that's our underpinning for all of the quality assurance, the systematic overview of the MS Flash program. And I'll talk with us a little bit about what that means. Then within that, we've got training, certification, monitoring of the protocol implementation. We offer support. DCC, Lynn will be available. We're also talking, as I'll show you later, about having an email query system. For example, we have quality assurance site visits. It seems like you're all very seasoned in the work that you've done. Is there anybody here who's not been on the receiving end of a quality assurance site visit? Okay, awesome. Well, it'll be a new experience. It's very much about partnering with the result to be the ideal implementation and to help problem solve. Anybody here in the room who's been on the giving end of a quality assurance site visit? Rebecca and I have, and yeah. So you know that it works in very much a partnership way. And then there are participant file audits where we can look at some of the checks, although the way, Mike, you described a lot of what's been going on or what's being planned for the database, a lot of the file audits, they'll be pretty streamlined, I think, because you've got so many data checks built into the data entry. Good clinical practice, it all starts there. So what is good clinical practice? Has anybody worked in an FDA trial where you're monitoring FDA, or anybody worked where the systematic underpinnings are good clinical practice? Anybody ever heard the words good clinical practice or GCP? Okay. Well, the good news is you really don't need to know a lot about it, because by working with the IRBs, that all comes into play. And all of the IRB materials and all of the guidance that will be in the manuals provides all of really what you need to know about good clinical practice. However, I thought it would be interesting for those of you who are like me, who like to know how did this come about. And so just in a real nutshell, what good clinical practice is about. It's essentially the assurance of quality and protection of human subjects. It's not singularly defined, but we do have a system that in the United States we follow. It's called the ICH 6E6, or ICH E6 guidelines. It's co-developed by the United States, Japan, and the European Union, and that involves, it's an international conference of harmonization, and the 6th section on efficacy has to do with good clinical practice. So this is, like a lot of things, it can be very jargony. So just hang in there, it's all on the slides. Just so you know that there is a specific definition for the ICH E6, you don't need to know it because you'll see different profferings of good clinical practice and the definitions may vary, but the essence is assurance. And what is done implementation-wise in the United States is through the Code of Federal Regulations. So that's called the CFR as an abbreviation. And if you'd like to know more information, there's a website that's on your slides, so if you really want to get into the nitty-gritty of what that's all about. The Code of Federal Regulations are actually 50 titles, and there are 2 of them that pertain to good clinical practice. But there's oodles of them, and these are just a few of what you could have to choose from should you go into the Code of Federal Regulations. You see Title 21, Food and Drugs, and Title 45, Public Welfare. Those are the ones that pertain to what we're about here. And it's kind of interesting, and why I'm putting this slide up here as an overview of the hierarchy. The federal regulatory departments and offices are under the United States executive branch. So we fall under President Barack Obama, who just named a new U.S. Department of Health and Human Services Director, Dr. Kathleen Sebelius. So the Code of Federal Regulations that you saw listed on the slide before, this has to do all with human protections. And it comes under this Office for Human Research and Protection. It covers all of the IRB issues. It's all there for us. It's all in place. If we were to be using a drug that needed FDA-specific regulation, it's called an investigational new drug, abbreviated IND. Or if we were using an investigational device, we would need to follow regulations and forms that come out of the Food and Drug Administration, and they're very specific. Dr. Freeman submitted, as we needed to, an application to the FDA about the escitalopram and the Lexapro that we'll be using, because it's a little bit, it's kind of off-label of what it's actually intended for the prescribed use, and received from the FDA what's called an exemption, an IND exemption, meaning we do not need to be tracking through the FDA-specific forms. But we're still following all the aspects of good clinical practice. And the reason it's so differentiated is you can see there are two different offices that are covering the CFR 45 and 21. That gives a little bit more of the detail. Let's focus on this piece. There are actually 4 parts, and some of these, the only reason I'm mentioning is you might hear mention of these either through your IRB or discussion. There's something in this CFR 45 called the common rule. It's the basic policy, and it covers all of the general protections for human subjects. And then we get into the specifics for pregnant women, fetuses, neonates, prisoners, and children, none of which apply to the study that we're working on here. This is all, I'm not going to go through this. This has to do, if we were going to be doing an investigational new drug, just to let you know that there are several parts that relate to the different forms and pieces that you have to apply for. It may be that we need that in one of the other pill trials, I don't know. But you just have this as background information in your slides. And this is the fortunate part. As long as we're working with our IRBs, we're covered. That's their job. They bring in all of the elements of good clinical practice along with, and then we take in that and put it in the manuals as well. So we're in good hands. When it comes to the protection of human subjects, which is the first part of what we cover in the QC piece of the manual, what you'll be needing to do is documenting informed consent. And there will be a checkbox on the data entry screen, right? Isn't that, yeah. And I know now to hear that there will be 2 types of informed consent for this trial, so there'll probably be one for each of those, or whatever is needed. And then also we'll have to be sure that you've got all your records in the charts. IRB review of protocols, privacy of participant information. You'll need to have locked cabinets. You're probably familiar with that as you've done that before. And there will be conference calls to help support that everybody's going about it in the correct way. Completion of human subjects training and security training. This is mandatory by your institution. Does this sound unfamiliar to anybody, like you don't even know what this is about? Awesome. Training, you're here now for training. By being here for this training, you have essentially become certified to provide the implementation for the Freeman Protocol. In the future, we'll have conference calls to cover anything new. If there are replacement staff and new trials, there'll be trainings to cover that in particular. We expect to be doing that kind of thing annually, plus we videotaped as well, so you'll be able to have access to that to review and refresh, and also to provide information for your other staff. Because we do have a train-the-trainer model, so you will be going back to your home base and training the staff that are working with you on the protocol elements themselves and the implementation, and then making sure, like I think it was Barb said, that Lynn, all of the institutional requirements for safe handling of biospecimens and such are followed.